has really bad heartburn and nausea. Whoa. Now I'm seeing dots. This is not good. I should probably go to the doctor. Uh-oh.
Hello. Hi. Come on in. Have a seat. I'm Shabin, the student nurse. You're the one that made the appointment today?
Yeah, I'm Hazal.
Okay. What brings you in today?
Well, I was just reading and I got really bad heartburn and nausea. And I started seeing little dots, and since I'm pregnant with twins, I didn't want to risk anything, so I came here.
Okay. How many weeks are you?
28 weeks.
28 weeks. And is this your first pregnancy?
Yes.
Okay. And how old are you?
19.
19. Okay, have you, I'm just going to ask you a few other questions, okay?
Okay.
Have you experienced any other symptoms in the past few weeks, like sudden swelling of your hands, face, or your feet?
Now that you've mentioned that, I did start getting sausage hands all of a sudden.
Okay. What about like any sudden weight gain?
I think so. I feel like I got a lot bigger really quickly.
Okay. And apart from today, have you had any other disturbance, like visual disturbances, like the blurry in the spots, or like the lights in front of your eyes?
I have, but I never thought anything of them.
Okay. Have you had any headaches that's like only like in front of your head and that won't go away with rest or Tylenol?
Yeah.
Have you had times where you felt lightheadedness or dizziness that won't go away with rest?
I don't think I have,
no. Have you had any heartburn, indigestion, or pain below your breastbone, which does not help with rest?
Yeah, I do.
You do?
Definitely. I just thought it was because I was pregnant.
And apart from today, have you experienced any nauseous or vomiting?
Yeah.
Yes. Okay. What about if you've had any pain or tenderness in the right upper part of your abdomen or under your ribs? That's unusual for you.
I have.
You have. And have you experienced any restless or feeling that doesn't seem right to you?
Yeah, it just didn't feel right today. That's why I came here.
Okay. Are you currently on any medication?
Just my prenatal vitamins.
Prenatal, that's good. And does anyone in your family have a history of high blood pressure?
My mom does.
Your mom does. So I'm going to take your blood pressure, okay? Okay, so I got 144/94, which is pretty high. What is your usual high blood pressure?
I usually have about 126/82.
Okay. You might be at risk for gestational hypertension. Has anyone ever told you what that is?
No.
Okay, so it's a condition in pregnancy that usually happens at around 20 weeks after pregnancy. It means that your heart has to work harder to pump the blood through your vessels all over your body. It could be mild or severe. It can have different effects on your body, like your organs, like your kidney, your liver, or your brain. It can also reduce the blood flow to the placenta and to the babies, which can affect your baby's growth and development. However, you will be closely monitored if that were the case, and there would be a whole lot of other tests that you would be going through. So I'm just going to go and tell my findings to the head nurse, and then we'll come back and she'll tell you what your next steps are going to be.
Okay, thank you.
You're welcome.
Hi, is it Hazal?
Yes.
Hi, Hazal. I'm Kristen. I am the nurse in charge for the day.
Okay.
So I understand you just had your blood pressure taken with Shabin,
Yes.
and it was 144/94. Is that correct?
Yes.
And what's your usual blood pressure?
128/82.
Okay. So what I'm going to do is I'm just going to take it for a second time. Okay?
Okay.
So I got 148/98. So that's still within a pretty high blood pressure. Anything over 140/90 is considered within that hypertensive range.
Okay.
So since we did get 2 readings of high blood pressures, I am going to refer you to get further tests done. They're going to test your urine, your blood, your liver, and your kidneys. This is just going to determine if you do have risk for gestational hypertension or if you have preeclampsia.
Okay.
All right.
So what am I going to do now? What should I do when I go home?
So when you go home, you're going to want to get as much rest as possible. Try to lie on your left side. That will help take the weight of your babies off of any major blood vessels.
Okay.
As far as your diet intake, do you have any salt on a regular basis?
Ever since I got pregnant, I'm quite partial to salt and vinegar chips every day.
Okay, so what you're going to want to do is try to reduce that salt intake. Try to replace that with water. You want to have at least 8 glasses of water a day,
Okay.
if not more than that. Okay, so you're going to have to come in for prenatal checkups more often. Most likely it'll be on a weekly basis now. We're just going to monitor your blood pressure, your weight, and the growth of your babies.
Okay. So what other things should I be looking for when I go back home?
So some signs and symptoms to look out for. So what you experienced earlier today, the nausea, the heartburn, those black dots in your eyes, any flashing or blurriness, definitely keep an eye out for an increase in that.
Okay.
If you get an increase in headaches or any pain in your belly, or if you do start to have some vomiting, if you notice that you're urinating less often, and if you don't feel any movement in your babies, then you're going to want to contact your healthcare provider right away.
Okay.
And I do have a list of some phone numbers I can give you.
All right.
So here's a little pamphlet. It has a list of all the important phone numbers you can call if you do experience any of those symptoms.
Okay.
Or you can come in and see us, and we'll just monitor the situation for you.
All right.
Did Shabin go over with you what to do at home for care for yourself and the babies?
No.
Okay, so you're going to want to monitor your blood pressure. If you don't want to go and buy a cuff, you can go into Shoppers Drug Mart and you can take your blood pressure on the machines they have there.
Okay.
Just keep a daily journal on that just to monitor what time of the day that you're doing that on. Try to do it in the morning or in the afternoon.
Okay.
And try to feel for any fetal movement in your belly and write down the times and the amounts of movement that you feel with that as well. And we'll take a look at that journal every time you come in.
All right.
Okay, any other questions for me?
No, I think I'm okay right now. Thank you.
All right, well, take care.
Thank you.
Hi. Have a seat. I'm so sorry. Oh my goodness.
Gonna do it again.
Yes.